What's up, my MS family? How are you guys doing today? I didn't do a video yesterday. Today is day 14 of my surgery for the fissure and hemorrhoid and skin tag removals. That's what he said as well. Yesterday I had my checkup, and he checked everything. Everything is healing well. I'm having minimal issues. I still have issues with pressure if I'm sitting too long, and I do have pressure that I feel if I have to use the bathroom. And normally, even with the pressure, it's not necessarily that I have to use the bathroom right then. I just know at some point it's coming, and until I actually go and do number 2, I have that pressure. Hopefully that will go away with the time. It's only been 14 days so far. As far as my urination, I still have a little issue with starting to urinate. I'm starting to think that that has nothing to do with the surgery itself. I've been to my doctor today. I'm a family doctor, and he referred me out to the big hospital, and it's about 2 hours away, to a urologist, because my urologist is really not doing all she can, I think, because actually she's a nurse practitioner, and ever since I've been going to her, I have never laid eyes on the actual doctor, which is crazy, because you would think he would want to meet his patients, see what's going on, because it may be something that I tell him that will trigger something that the nurse practitioner may not know, but I guess that's not their thinking. So I will be traveling on the 9th to a big hospital, MUSC, to the urologist to see what's going on. I did a urine sample today with my doctor, and he's saying, you know, of course, it's been continual blood in my urine, and it doesn't have anything to do with a busted stitch or anything this time. I just still have blood in my urine for some reason, and it's, you know, not like a cycle thing, you know, it's just, you know, we don't know where it's coming from yet, anyway. And as far as my surgery, really, there hasn't been any hiccups, honestly. I just think, you know, that if you want to go for the surgery, definitely it's your choice, but again, I have had no regrets. I went from a level of 15 pain, probably plus, some days, because I have been up literally 12, 1, 2 o'clock in the morning in this car, cranked up with the heated seats going, trying to get pain relief, crying and rocking. That's just how bad it was. And when I met with the doctor on yesterday, he said that, you know, all the samples that they sent out came back fine. It was, you know, all hemorrhoid tissue or skin tag tissue, so that was fine. He also said that with my condition, you know, because I had so many hemorrhoids and skin tags back there, there was no way they could have seen the fissure in the first place unless I went to surgery. And when he went to surgery, he said that it was a pretty big fissure, so, you know, there was no way that was going to get better without surgery. So I'm definitely happy, you know, I pushed him to have the surgery, because, you know, who knows your body better than you? And, you know, we are our own best advocates, you know, even though doctors don't listen. You just have to keep pushing, and keep pushing, and hopefully there will be a breakthrough. And if not, you just have to find someone else, which is what I'm in the process of doing now. I still get tired a lot. Again, that could be the MS. I could have just a slow recovery from, you know, just that small surgery that was done. I did let my doctor know today that I'm still having issues. I have issues with GERD. Food sometimes feel like it sits at the top of my stomach. I get bloated when I eat, no matter what I eat. And I'm getting pains in my stomach when I eat. So he referred me to a GI, and I go to him on the 3rd. Well, I go to the doctor. I go to the ER on the 3rd, which is where I'm going to have my procedure done here locally, so that they can look down my throat with the scope and see what the fudge is going on. I know it's not in my head, and like I told my doctor, I know that, when I say I have these issues, I literally have these issues. It's not that, I'm telling them something because I want pain pills, because when I come to them, my thing is not pain relief. I want an answer as to why, what, whatever is going on, because once I know what's going on, that's going to ease my mind a whole lot better, and it's going to calm me down. Not that I'm, freaking out like that, but it does give you a sense of relief to know, what is going on with your body. So I will have an answer from my GI on the 3rd. Hopefully on the 9th they can give me some answers as far as my kidneys, because my lower abdominal back pain, I have still having pain. If I sit up too long, I'm having pains, and it shouldn't be like that. And I'm having to pop some kind of Aleve or Advil or something throughout the day, just to ease the pain or lay down. I do still, though, after the surgery, I still don't sit up. I do sit up a lot, but my body lets me know when I've had enough, and I will go ahead and lay it down and get some relief that way. I still use my squirt bottle to clean. I have started using my all-natural Huggies wipes to help with cleanup. I still do the blot with the paper, with tissue as well. So I use the squirt, blot. If there's anything I see, I go back again with the squirt bottle, as many times as I need, and just blot dry, and then I will follow up with the wipe gently, just to make sure I'm keeping that area clean, because I do not want any type of, bacterial growth, any type of infection to occur. I also spoke with my doctor today about the COVID shot, and he's recommending, I go ahead and get it, because of my MS, and I was a little concerned, still a little concerned, but, I'll just leave that at that, because, it's a personal preference thing. And, again, when these kids start to school, our governor here has already made the mandate, when the kids start school next year, that next school year, which starts the August 20th, he's giving parents the opportunity to sign off where their kids don't have to wear a mask anymore, which is what prompted me to even want to do the vaccination, because we live in a world where people don't like rules, and I'm quite sure the majority of the parents are going to sign off for their kids not to wear masks, even though it would be in their kids' best interest to do so. But it's just the world we live in. So me and my kids will be going on the 1st of June to get our vaccinations. So we'll see how that goes, and trust and believe, if there's anything out of the ordinary, if I feel weird or whatever, I will definitely report, because my thing is, I'm going to tell you detail for detail, everything that's going on, and it's not to scare anybody, it's just to make you aware, because again, this is all about how my body is handling things, that I go through. I see my neurologist tomorrow, so I will finally get to go over the 3 sets of MRIs that was done of my head. What did he do? Anyway, I know it was 3 sets. It was like over an hour long. It was ridiculous. And let me tell you, I laid on that table so long, they literally almost had to peel me off of that table with a spatula and some grease, because my body just didn't want to move, because I was in one position for so long and they don't want you to move. So I will get those results tomorrow, and I'm gonna, just ask him his opinion about the shot as well, since he is the neurologist. And I think I covered as far as going to MUSC about my kidneys, because I started to say I had the urine sample done today, and he was saying that with the blood in the urine, he was still showing, and also that as far as like bacteria, it was just like too much to count. It was that way a little less than a month ago. So I don't know what's going on. Maybe I'm retaining urine and that urine is causing these infections. I'm not sure, but I will find that out hopefully come the 9th of June. But other than that, that has been really the bulk of what's been going on. Just trying to get myself together. That don't work. Just trying to get myself together. And hopefully when I go to these appointments, I will get some answers that I need. So again, neurologist tomorrow, shots on the 1st, GI appointment on the 3rd, and specialist on the 9th. And I do have to go back and see my family doctor on the in a week, because he wants to go over the medications that I am taking and that I'm not taking, because trust and believe, everything he prescribes me I do not take, because I'm not gonna be a pill popper for everything, so we'll go over some things and see what I should be taking or shouldn't be taking. And that's the amount of pill bottles that I have is ridiculous. So we'll see what I should keep and shouldn't, because right now the only thing I'm taking is my water pill, my pills for my bladder, so that I'm not going to the bathroom as much. Sometimes they work, sometimes they don't. And I take probiotics. I still take stool softeners, and that's about it. Now I did let him know, my neurologist wanted me to go back on pregabalin, but it really, I didn't see much difference when I was taking it. So I don't know that I will go ahead and do that again. But again, I will let you guys know what's the what, and I will update you guys as things come along, and I will let you guys know on tomorrow what the neurologist is saying as well, as far as my MS, where I'm at, where he wants me to go. And 9 times out of 10 he's probably going to take me off of Ocrevus, because I keep having these UTIs. I don't know what the next step will be for that, but I will let you guys know as well. So until then, I hope you guys have a good morning, a good evening, good night, wherever you are in the world, and I will talk with you soon. Bye.